Okay, so we have 3 borders and 3 angles to start with that we're going to be concerned about. The 3 borders, the border that's associated with the shoulder joint is going to be the lateral border. You can see this posteriorly here and anteriorly here. So that's going to be the lateral border. And then the medial border is relatively featureless. And if you look at it, it's just really smooth and doesn't really have any markings on it that give attention to it. So the medial border is the really smooth, featureless one. And then along the top, we have the superior border, and you'll notice that it's kind of irregular here, and especially at this point right here where there's this little dip or this little notch. Okay, and the superior border contains then something we're going to call the supra, which is a word that means above. So suprascapular notch. Okay, the notch at the top of the scapula. Okay, so that's the suprascapular notch, and this is a passageway for nerves and a nerve that innervates 2 of the muscles that move the scapula. Okay, so let's go ahead and go to the next slide then, and then see the angles that we're talking about. So the angle at the base of the scapula, this is the easy one. It's the inferior angle. And then the angle formed by the superior and medial borders right here is going to be the superior angle. And then the border or the angle formed by the shoulder joint or the glenoid cavity here, the prominence that holds the glenoid cavity. This is going to be the lateral angle. Looks like I didn't get the L in the diagram over here. Okay, so go ahead and go to the next slide. Posterior surface, one large marking. Posterior surface is marked by a ridge of bone running medially to laterally and angling slightly superiorly across the upper portion of the surface, and this is going to be called the spine of the scapula. Okay, so this is the spine of the scapula, and you'll see that in the next diagram. And this is the site of attachment for several important muscles. It's like a handle that you can grab onto, grab a hold of, and yank on it, which is what the muscles actually do. Okay. And then the lateral end of this enlarges into a process of bone that arches over the shallow glenoid cavity. Okay, the glenoid cavity is the cup of the shoulder joint, and the arch of bone or the process of bone that arches over it is called the acromion process. Acromion process. Okay, and this process articulates anteriorly with the clavicle, forming the acromioclavicular joint. The acromioclavicular joint. Okay, so we can see here the spine of the scapula, and again you can see how it looks like somebody could just kind of reach out and grab a hold of that and yank on it in an upward or downward direction. And we have the acromion process that arches up and over the glenoid cavity here, and you can see how shallow that glenoid cavity is, and that would end up being fairly unstable. Okay, for the anterior surface of the scapula, we have the acromion. That's the major marking. We can also see you can see the acromion and where the acromioclavicular joint would be. But just medial to the acromion and anterior to the shoulder joint is a second large process of bone that points laterally, and this is going to be called the coracoid process. the coracoid process. And this is also the site of attachment for some muscles, some of the arm muscles. Okay, so we've pretty much covered the features of the anterior and posterior scapula. Look at the shoulder joint then from the lateral position, just superior to the lateral angle and inferior to the acromion is a shallow cup-shaped cavity in the lateral border of the scapula, and that's going to be called the glenoid cavity. Okay, and this cavity is bracketed by the acromion process and the coracoid process, and we're going to have muscles that come down from that and tie into the arm at various points in order to help move the arm appropriately. And also be aware then that ligaments and muscle attaching to the structure surrounding the cavity hold the head of the humerus in place. So we're going to have the head of the humerus fitting in here, and then we're going to have all these muscles and all kinds of ligaments tying around this muscle to hold it in place, or this bone to hold it in place. Okay, so the last thing to consider then is the range of motion of the pectoral girdle and the upper limb. The pectoral girdle and the upper limb have a huge range of motion. There are a lot of motions that you can complete with the arm and the pectoral girdle that you can't even begin to think of completing with the pelvic girdle. And the range of motion is due to three factors. The only real attachment that the axial skeleton has to the pectoral girdle has to the axial skeleton is at that single point at the acromioclavicular joint. So there's nothing from the axis then that's actually limiting the significant movement of the pectoral girdle. There's some muscle that comes from the chest cavity that guides and allows the pectoral girdle to go various directions, but there's not really anything limiting its motion to a significant degree. So because of that, the clavicle serves as basically a hinge there for the pectoral girdle in its up and down motion. Then we also have relatively loose attachments of the scapula to the posterior chest wall. It's bound fairly tightly by the muscle that holds it to the posterior chest wall. But what these muscles in particular allow are for the sliding of the scapula over the surface of the back. Okay, we have this scapula, this thing that's gliding over the surface of the back and helping to stabilize the shoulder and provide additional motion. And then the mobility provided by the shallow glenoid cavity and the surrounding ligaments and muscles is also key in this point. There's nothing holding the shoulder directly together. It's there's nothing directly holding the shoulder together. So the mobility is very, very great, while at the same time the shoulder joint and the surrounding muscle and tissues are at risk from injury because it's not as stable as it could be. Okay, so the shoulder is relatively easily dislocated, sacrificing stability for a huge range of motion. So what I want you to be aware of, what I want you to know are these features of the scapula. So I want you to know the clavicle. I want you to know the sternoclavicular joint. I want you to know the acromioclavicular joint. I want you to know the scapula. I want you to know the humerus. I want you to know the sternum. I want you to know the inferior angle, the medial border, the lateral border, the spine, the posterior angle, the posterior surface, the superior angle, the superior surface, the suprascapular notch, the glenoid cavity itself, the acromion process, the coracoid process, and then the lateral angle as well. Okay, so know all of these features and be ready to take a question of the day on it, as you'll find in an assignment soon. Okay, so that's it for this, and we'll, as far as the question of the day goes, it'll look exactly like this. It'll have these letters pointing to different things, and it'll have a list of words, but the list of words will be mixed up, and the blanks in front of them will be blank, so that you can fill in the correct term, or the correct answer to the correct term. Okay, so that's all we're going to do.